Hello, my name is Sam Boswell and I've been practicing neuromuscular therapy since 1989. Today I'm going to discuss myofascial trigger points. Myofascial refers to muscle tissue and the fascia that enshrouds it. Fascia is a connective tissue. You may have experienced if you've cut open a chicken and that real thin film membrane that goes around, say, the chicken breast that you pierce, and then it reveals the actual fibers of the muscle tissue. So to better help you understand what a myofascial trigger point is, let's take a look at some slides. This first slide is a graphic representation of the spinal cord and a trigger point as denoted by the star. The various characteristics of a trigger point, as seen on this slide, are increased metabolism or cellular goings-on, decreased function in the case of a muscle. It may inhibit the muscle and it won't be as strong. The tissue associated with the trigger point will also have compromised blood flow, which will keep it from getting nutritional support and from evacuating metabolic wastes. And that may all lead to referred pain, which will be at quite some distance perhaps from the trigger point. Seldom is it in the area of the trigger point. This next slide lists the various causes of trigger points. Strain, if you bend over and pick up something too heavy, you can pull your back muscles. You could be working out in the garden all day and not really strain it, but you've just exhausted it, and look, you got trigger point forms in the area. Additionally, if it's cold and it chills that tissue, a trigger point can form in it. And of course, gross trauma or some serious injury can cause trigger points. This next slide shows what a trigger point does in that it sends a noxious signal to the spinal cord, and then a reflex is developed, as seen in this next slide, a perpetuating reflex. And what happens is the noxious signal goes to the spinal cord, and the spinal cord sends a signal back to that area and causes it to tighten up. It causes further ischemia or lack of blood flow, and then that of course becomes more noxious signal sent back to the spinal cord. Well, if that keeps going long enough, you're going to get a referred pain zone. And the referred pain zone is, as I said, some distance from it, but it sends that pain signal up to the brain. So it's a noxious signal that actually makes it up to the brain, and that's how we perceive that it's pain. Left untreated, as this next slide demonstrates, a trigger point can form in the referred pain zone, and then this whole cycle can start over again. Now let's take a look at a typical neuromuscular therapy session. Sarah has graciously agreed to be my model for today. And what I'm going to do is just introduce to her the neuromuscular therapy techniques, the criteria for determining when I've reached the proper depth. In neuromuscular therapy, there is a technique called ischemic compression, and I'm going to gradually increase the pressure on a point until she tells me when to stop. Now, she'll do so when that pressure is perceived on her part as being a pleasant challenge. That is, she won't tighten in response. On a scale of 1 to 10, about a 5 or a 6, but certainly no more than that, because what we're interested in doing is re-educating the nervous system so that it stops making that trigger point area be all bothered. So, to demonstrate, I'm going to just pick a point on a muscle. I'm going to gradually increase the pressure until she tells me when to stop.
Stop.
Okay, right there. Good. And I'm going to just hold it for about 8 seconds. And then I'm going to let go. And I'm going to proceed to other areas of the body. In fact, let's take a look at some of the other areas. For example, the neck. Okay, now Sarah, tell me when.
Stop.
And that's about 8 seconds now. And the final example is the back. I'm going to gradually increase the pressure until Sarah tells me when to stop.
Stop.
And I'm going to just hold it for about 8 seconds. And typically what I do when I treat the back is I go all the way up the back and do an entire muscle, because I want to cover all of that muscle because it has changed its behavior because of the presence of a trigger point. Those are a few examples of neuromuscular therapy. If you have any questions about this video, don't hesitate to contact me.